The following definitions apply to the vulvectomy codes, 56620 to 56640. Simple, the removal of skin and superficial subcutaneous tissue. Radical, the removal of skin and deep subcutaneous tissue. Partial, removal of less than 80% of the vulvar area. Complete, the removal of greater than 80% of the vulvar area. Vulvectomy simple, partial. A complete vulvectomy includes removal of all of the labia majora, labia minora, and clitoris. Vulvectomy simple, complete. 2 wide elliptical incisions encompassing the vulvar area are made. 1 elliptical incision extends from well above the clitoris around both labia majora to a point just in front of the anus. The second elliptical incision starts at a point between the clitoris and the opening of the urethra and is carried around both sides of the opening of the vagina. The underlying subcutaneous fatty tissue is removed along with the large portion of excised skin. Vessels are clamped and tied off with sutures or are electrocoagulated to control bleeding. The considerable defect is usually closed in layers using separately reportable plastic techniques. Vaginal gauze packing may be placed in the vagina. Vulvectomy radical method. The physician removes part of the vulva to treat malignancy. Through incisions in the lower abdomen, thighs, and vulvar area, the physician removes skin, subcutaneous fatty tissue, and deeper tissue. Also included in the en-bloc removal of tissue are portions of the saphenous veins and ligaments and the target lesion. The resulting large and disfiguring defect is usually closed in layers using plastic surgical techniques, which may include pedicle flaps or free skin grafts. Subcutaneous rubber drains may be left in the surgical site, and vaginal gauze packing may be placed in the vagina. Vulvectomy, radical, partial. A partial radical vulvectomy includes partial or complete removal of a large, deep segment of skin from the following structures: abdomen and groin, labia majora, labia minora, clitoris, mons veneris, and terminal portions of the urethra, vagina, and other vulvar organs. Vulvectomy, radical, partial, with unilateral inguinofemoral lymphadenectomy. With bilateral inguinofemoral lymphadenectomy, the physician removes part of the vulva to treat malignancy. The physician also removes superficial and deep inguinal lymph nodes and adjacent femoral lymph nodes. Vulvectomy, radical, complete. A complete radical vulvectomy includes the removal of a large, deep segment of skin and tissue from the following structures: abdomen and groin, labia majora, labia minora, clitoris, mons veneris, and terminal portions of the urethra, vagina, and other vulvar organs. Deep tissue from more than 80% of the vulva is excised. Vulvectomy, radical, complete, with unilateral inguinofemoral lymphadenectomy. With bilateral inguinofemoral lymphadenectomy, the physician also removes the inguinal and femoral lymph nodes. Vulvectomy, radical, complete, with inguinofemoral, iliac, and pelvic lymphadenectomy. The physician also removes the inguinal and femoral lymph nodes on both sides as well as the iliac and pelvic lymph nodes in the pelvic cavity, which is entered through an abdominal incision. Colpotomy, with exploration. Colpotomy is an incision in the wall of the vagina. Through a speculum inserted in the vagina, the physician grasps the posterior lip of the cervix with a tenaculum. The cervix is lifted, exposing the posterior vaginal pouch. An incision is made through the back wall of the vagina into the posterior pelvic cavity. Through this opening, the pelvic cavity can be explored using instruments. After exploration, the physician closes the incision with absorbable sutures. Colpotomy, with drainage of pelvic abscess. The abscess in the cavity is located, entered, and drained through the vaginal incision. Rubber drains are often inserted and left in place for several days. The physician closes the incision with absorbable sutures. Hymenotomy, simple incision. The physician performs a hymenotomy. A hymen is a membrane that partially or wholly occludes the vaginal opening. Following local injection of an anesthetic, the physician incises the hymenal membrane with a stellate, star-shaped, incision.